Welcome to Parenting Unscripted. I am your host, Katie Collett. A big thank you to Norfolk Public Schools for sponsoring this episode today. We are about to have a great chat about a very important topic. We are talking about pelvic floor therapy with two experts from Chesapeake Regional. We have Kelley Lucy, who is a physical therapist, along with Catherine Joseph, who is also a physical therapist. Both ladies specialize in pelvic floor physical therapy. So why don't we start, Kelley, with you? First of all, welcome to Parenting Unscripted. This has been a long time coming. It's hard to get you in here because you're so busy, which we love. Being busy is great. Kelley, I'd like to start with you. Why don't you share with everyone what the pelvic floor is?
So the pelvic floor is a group of invisible muscles, emphasis on invisible, that provide support for the pelvic organs, help with function of bowel and bladder, as well as sexual function. I like to describe this to patients when I'm first interviewing a patient, like kind of like a hammock that, when contracted, provides that support for the pelvic organs and help with the bowel and bladder function.
And it's so important because it's really impacted a lot. And I feel like to just say a lot doesn't do it justice, but a lot during pregnancy, right, Catherine?
It sure is. Absolutely. The pelvic floor has to stretch, and we want it to stretch. That's the most optimal thing that can happen during delivery. And if it doesn't stretch properly, then there can be some resulting tearing and lacerations and damage to the perineum. So that's one thing that we encounter.
Mm-hmm. Why don't we really dive into what exactly does happen to the pelvic floor during pregnancy? Because as a woman I had a very large baby. I had a 10-pound, 4-ounce baby. So I don't feel like you necessarily snap back from that super quickly or easily. So I know a lot about what happens with the pelvic floor through personal experience. Does the size of the baby matter? And what exactly does happen? What changes during pregnancy there for either one of you?
I would say hormonal changes are, as we all know, just in preparation for birth, just the natural hormonal changes happen. And that's in preparation for the stretching of the tissue, which obviously helps with a vaginal delivery, as well as a cesarean, just because of all the changes in the tissue.
Some of those hormonal changes might also lead to some joint laxity. And that's normal because we want those areas to accommodate the growing fetus. So that can also cause pain for some individuals in the lower back and in the sacroiliac joints.
Mm-hmm.
Why does all of this tend to happen, especially during pregnancy or even as people age?
I would say this happens just like I said, in regards to just the natural changes in order to for the baby to be delivered vaginally, and I guess really just for the baby to come out with less issues and less trauma.
Yeah, that makes sense. Is pelvic floor therapy something that is recommended, Catherine, during pregnancy?
Yes, it is recommended during pregnancy, but a prescription would be required first. It's an opportunity for us to assist patients who are having urinary incontinence or pain issues, but it's also an opportunity for us to provide education on and initiate manual techniques such as perineal stretching, which is a method that's designed to help minimize the risk of trauma to the perineal area during vaginal delivery.
Okay. And let's talk a little bit more about what exactly the physical therapy would look like for any of these situations that could arise. Kelley, I'll go to you for that. How do you do this?
So at the hospital at Chesapeake Regional, we have had the opportunity to use a certain type of machine that provides biofeedback and neuromuscular electrical stimulation. How we use that machine depends on the diagnosis, and it depends on the patient, obviously. And to our advantage, the biofeedback, going back to where I started regarding the invisible group of muscles, that's where the biofeedback is so very important because of the changes that we've talked about regarding the, possible tearing or the trauma or the muscles stretching significantly to accommodate the baby and for the baby to be delivered. Just to be able to help with that sensory awareness that can be impacted during the delivery. And that's where the biofeedback is very important.
Is that really the biofeedback? Is that one of the only ways, or are there techniques that women can do at home as well?
Well, that's not the only way.
Yeah.
We teach women how to do specific exercises for homework. Once we can identify that they're doing the pelvic floor contractions properly, then we can send them home with some exercises to do. That doesn't necessarily entail having to use any equipment.
Got it. What do those exercises look like? And I'll open it up to either one of you. Whenever when one of us has to go home to do something like that, what kind of exercises are we talking?
The most common that everyone certainly is familiar with is a Kegel exercise. And a lot of times people assume that they are doing this muscle contraction correctly, and that's where we're able to assist, help as needed to make sure that contraction is performed correctly, because that's the foundational exercise before we progress into any type of core exercises or anything that would help with pelvic pain or incontinence or prolapse.
Right. Catherine, how exactly do you explain to do that correctly? If so many people are doing it incorrectly, what would you say is the way that you describe it for your patients?
Well, let's see. Sometimes we need to give cues where we tell them, okay, we want to engage the muscles as if we're stopping urine flow or stopping gas from passing. So we use terminology, an elevator analogy, if you will.
Love that one.
Where we cue the patient to close the elevator doors and then draw the elevator up to the various levels. And then we watch them to make sure they're not doing any substitutions and using other muscles that they're not supposed to be using, that they're coordinating the breathing properly with the contractions, and that they're also able to elevate her back down after doing the pelvic floor contraction. So that's one method.
Yeah, it's very helpful. And I want to talk a lot more about that because I know this is really important for a lot of women to learn, and they don't even really realize initially that they need to know these things. So we are going to talk more about pelvic floor therapy when we return in just a moment after this break. Stay with us.
Whether you're already working in education or aspiring to, then say yes to NPS. Norfolk Public Schools are currently hiring in the following positions. NPS offers the highest salaries and sign-on bonuses in Hampton Roads, plus a work lifestyle you'll love. Say yes to NPS.
Welcome back to Parenting Unscripted. I am your host, Katie Collett, and today we are talking about the pelvic floor and how after you have a baby or just different points of your life, you can get everything where it needs to be. And we have two pelvic floor specialists from Chesapeake Regional joining us. Ladies, thank you again for being with me today. This is Kelley Lucy, who is a physical therapist, and Catherine Joseph, also a physical therapist. So why don't we talk about, I know that we've touched on a bit about what happens during delivery, but I really want to be clear because Kelley, you had mentioned that the pelvic floor is really invisible. And I think when some people think about it, when it comes to delivery, they think, okay, well, if you have your baby vaginally, your pelvic floor is kind of going away. They just envision out comes the baby and there goes the pelvic floor, but that is not the case, right?
Correct. I would say one of the things I enjoy most about PT is being able to explain and educate to patients that the muscles never go away. The muscles are significantly stretched during a vaginal delivery, but they also retract and come back into their normal place. Maybe they're not as proficient or as efficient as we would like for them to be, but that's where the understanding of those muscles are still there. So if the muscles are still there, then they can be trained and retrained to better enhance our life if there is an issue in that area.
I think you just gave so many women so much hope when they realize, yes, those muscles can come back. So Catherine, let's talk a little bit about delivery and the time after. What do you recommend for women to do, or, when it comes to delivery? We're talking, I know controlled breathing was something that we discussed. How does that help, and why is that important during delivery?
Well, there are a variety of different breathing techniques, but when they're implemented can have significant benefits. I feel the first thing is that it helps with managing pain.
Yeah.
It helps to promote muscle relaxation. It helps you to stay focused during contractions and to have better muscle coordination. And all of those things are in an attempt to help protect the perineal area during vaginal delivery.
And that would obviously make a very big difference in what we're talking about today. Why don't we talk a little bit too about how soon after delivery someone can start pelvic floor therapy? Kelley, go ahead with that.
First, we would certainly need a prescription from the doctor to start physical therapy, and you would need to be released. Typically, after a vaginal birth, that could be 6 to 8 weeks. After cesarean, that might be a little longer, depending on the scar from the surgery. But typically, about 6 to 8 weeks is when we would first see a patient after a delivery.
Why is it something that would need to have a prescription? Why is it not something that, if a woman says, I feel like I need this, how come it's something she can't just get? Because we know our bodies, right? Are you able to?
Yes.
Are you allowed to answer that? Put you on the spot. But it just kind of feels like something, and maybe that's something that we hope for in the future, where it's like, well, I feel like I need this. I guess I just never realized until we were talking that you actually would need a prescription.
I think insurance dictates a lot of that.
Oh, okay.
That's the reason why a prescription is necessary. But then it's also an opportunity to be medically cleared, and that's usually that 6 to 8 week time frame. Yes.
So it's important for the doctor to be able to say, okay, yes, you are okay to do this
Yes.
at this time. Let's talk about that 6 to 8 week period. What is happening in that time that helps a woman heal to be able to be properly ready to address pelvic floor therapy?
I think that some of it depends on, if there was some tearing involved
Right.
in the perineum, that will obviously be guided once that delivery occurs. I'm sure the nurses at the hospital will, give them instructions on exactly how they handle those things at home. But the muscles are, there's healing, there's scarring that's happening. Because anytime there's a cut in our body anywhere, there's a healing and scarring that happens. And during that time frame, that is obviously occurring. And of course, any other changes in the body, just after the delivery is happening during that time frame.
Yeah, you really do need time to just start to feel like yourself again before you really kind of go out and try some new things to make you feel even more like yourself.
Right.
Is this a case where it is the sooner the better when it comes to therapy here?
I would say the sooner the better, definitely. We have women of all ages that come in for treatment and for help in these areas if they have issues, but the sooner we get started, the better. I feel like it's an opportunity to educate patients on their bodies and how these things will help in the present time, but also in their future selves. We want to make these connections for the patients so that they have a full understanding of what's going on with their body currently and in the future as well.
Kelley, what are the signs that someone needs pelvic floor therapy?
Pelvic pain, painful intercourse, urinary incontinence, urinary urgency. Any type of pain in the pelvic area.
And Catherine, anything to add to that? Are there any other signs or symptoms that you think that women experience?
She covered up most of them. I think
Yeah.
the only other thing would be the diastasis recti abdominis, the separation of the abdominals.
Oh,
That could be another thing to
That's-
address for sure.
When I was pregnant, that did not happen to me, but can you explain a little bit more about that, Catherine, for those who are, who've just become pregnant? They may not know exactly what that means.
So it is a DRA is a separation of the abdominals at the linea alba, the midline line right down the center of our belly. It's a naturally occurring process during pregnancy. For some women, this will heal on its own spontaneously after delivery, which is great, but for a lot of women, it will not. And so there needs to be a little bit more of a deliberate approach to assist with the healing process.
And that is part of what the pelvic floor therapy does as well. That helps to tighten and bring those muscles back.
We really try to re-educate patients on how to engage their abdominals properly to help approximate that gap. Yes.
Yeah.
It starts
Prior
with
to movements.
precautions.
It starts with
precautions, just so that we help patients not continue to make that separation worse.
When you say precautions, how so? What do you mean by that?
How you get up from a chair, how you get up from the bed.
Yeah.
We emphasize
Engaging.
log rolling.
You don't want to overly engage your abdominals when you're going from a lying down position to sitting up. That causes a coning or a bulging effect there, and over time, if it's not addressed, can worsen.
Oh, that makes sense. I love hearing all of these things because I feel like I'm getting an education at the same time that we're all just chatting. So ladies, thank you very much. We're going to be right back for our last segment here where we're talking about pelvic floor therapy and the importance. And I thank you for taking the time today. We will be right back. Welcome back to Parenting Unscripted, where we are talking about the importance of pelvic floor therapy. We have two very special guests today, Kelley Lucy and Catherine Joseph, both of Chesapeake Regional, who are specialists when it comes to the pelvic floor and physical therapy. So again, thank you for carrying on this conversation with me. I have learned so much in the last 16 minutes, and I know that I'm going to learn more. Let's talk about if there's a way to properly strengthen the pelvic floor muscles, Kelley, before pregnancy or in preparation for pregnancy.
I think one of the things that is good for us to remember, especially if we're preparing for delivery or going to have, once we have the baby, it's not just about strength. It's also about being able to relax those muscles, which that's where the breathing comes into play, because you need to be able to relax the pelvic floor muscles, that group of invisible muscles. You need to be able to relax them in order for the baby to be delivered vaginally, and therefore there's less trauma that can take place if those things are in place. So yes, strengthening is very important, but it's also important not only to be able to contract your pelvic floor, but to also be able to release your pelvic floor and know the difference and feel the difference.
So, Catherine, is there, you want people to understand how to do this properly, right, before they try to do it on their own?
Yes. So we can take a look at how they know or have been taught or learned to do a pelvic floor contraction or a Kegel. So we assess whether or not they're doing any substitutions or compensatory type of movement patterns, and try to correct those things. During pregnancy, though, we can also use biofeedback. We're not, going to run electrical stimulation as a treatment, but we can watch an EMG, real-time EMG graph, and assess their contractions that way. The patient can see the contractions on the screen, and so we can utilize that as a training tool to make sure that they're doing their contractions, their pelvic floor contractions properly.
That's so fascinating. Kelley, let's talk about, there's someone maybe years down the road they've had birth, after they've given birth, and they sneeze or spontaneous laughter, and there's, a little bit of a trickle. You kind of lose your pride a little bit after you have a baby. At least you feel like that initially. But years down the road, they're still having these problems. Is there a point of no return, or is there still hope?
So first, I would start by saying that I think that there's a myth that people come to understand that if I've had a vaginal delivery, a cesarean delivery, or I'm just older, whatever that might be, even if you've not delivered a child, the leakage, it doesn't have to exist because the muscles are still there. That's the beauty of it all, is that the muscles are still there and we can still do something about those muscles. If there's a nerve connection to muscles in our body, you can make a change.
I think that is huge. And I think it's so important for people to understand the myths that are out there. Just because you gave birth, just because you're older, does not mean that there isn't something that you can do to help yourself. I think that that's huge. Catherine, do you notice when you do this with women, how does it impact them? Do you feel like it builds their self-confidence, or what do you notice in your patients?
It does wonderful things to their self-confidence. Women come to us and they're afraid of doing certain activities, things that they used to do that they may not be able to do now because of fear or apprehension of leakage or pain or those things. So when we are able to make an impact, they come in, they work hard, and they're consistent. With their efforts, it is a complete turnaround in their life, and it's an improvement in their quality of life. And we feel that with all of our patients whenever they finish their journey with us. So
It's very life-giving.
It's very life-giving. It's very rewarding, and so we're making impacts on quality of life, and allowing women to get back out there and do the things they wanted to do again.
I think that's so special. And Kelley, I could see you grin from ear to ear when you were talking about the impact it has on patients' lives. What has the experience been like for you?
When someone is in a valley and they need to climb a mountain, it's nice to have someone come along the journey. And I would say that's where Catherine and I have our passion continues to come through, because it's life-giving to be able to see people's lives changed. And for them, people are so surprised at the fact that this is an area where change can happen. And if we can be a part of that change, then it is very life-giving for us.
It is.
How did both of you, and Catherine, I'll start with you. How did you realize this was something that you wanted to get involved with and specialize in?
Well, I feel like there are different things along, your path in life that lead you into this direction. So I have some of my own personal things and, women's health issues that I feel like were kind of nudging me along into this path. And I have a stronger background in orthopedics, and I think that's helpful as well because there's a lot of overlap. But yeah, there were just certain things, certain events in my life that I feel like put me down the path to, emphasizing or spending my time in pelvic floor and helping these individuals.
I think it's so special when someone has their own life experience and they're like, you know what, I'm going to learn from this and I'm going to take the time to teach others. So I love that you said that. I think that that's absolutely wonderful. Kelley, what about you? What made you decide that this was something that was important for you?
My background is in athletic training, so I have a certification as an athletic trainer. And so for years, I worked with athletes. And one of the beauties with that particular process was to be able to partner with athletes to get back on the field or the court or whatever that might be. And they were always very, very motivated. There was a different type of motivation because they had a goal in mind. I liken that to the pelvic floor rehab as well. This is a group of people that want to get better. They will climb the mountain. They'll do whatever they need to do to get to the other side. And it's a great joy for me to be able to partner with them to help them get to the other side.
Well, Kelley Lucy and Catherine Joseph of Chesapeake Regional, thank you for taking the time today. I'm so happy that we could get you in here. I know that pelvic floor therapy changed my life after childbirth, and with my battle with multiple sclerosis, it helps in so many ways. So thank you for what you do for all of the people out there in our community, and I really hope that a lot of folks learned something today. So again, I appreciate you very much. Thanks so much for being here. And I hope you all enjoyed this episode of Parenting Unscripted. Remember, you can watch new episodes of Parenting Unscripted right here on Wavy Plus every Tuesday morning at 9 o'clock. And again, thank you to Norfolk Public Schools for sponsoring this episode. I hope you all have a wonderful day. Be good.